Hello. Welcome to the summer 2022 Grand Rapids Community College Registered Nurse Pinning Ceremony. Sorry. I'd like to thank you all for being here and joining us on this very, very special hard-earned day, the day that concludes our long, hard battle with nursing school. I'm Carrie Nevius, and I will be introducing you to our wonderful speakers. So to start our ceremony, we have Ryan Delminer. I think I said that right. Please welcome Ryan to the stage.
Thank you. Look at you all. Beautiful. Most of you. I'm just kidding, all of you. So I'd like to start things off. Can you hear me? Should I go louder? Okay. How's that? Okay. So I'd like to start things off by recognizing the students who planned this event. Our entire class was asked if anyone would like to volunteer to help plan this ceremony, and nobody stepped forward. It was dead silent. But from that silence, 3 heroes emerged: Carrie Nevius, Emily Morales, and Nikki Kermath. Please stand and be recognized. Thank you. The fact that they managed to do all this while frantically trying to study to pass their finals is beyond me, so thank you, healthcare heroes. I'd also like to welcome all of you today, and thank you for being here. If you've been invited here today, I can safely assume that you've been nothing short of essential to our survival and sanity over this past year or so. Personally, I wouldn't have been able to do the unspeakably horrific things I had to do in order to graduate without the support of my family and friends. And I think I can speak on behalf of everyone here when I say that they feel the exact same way too. When I was first nominated by a classmate to speak today, thanks Aaron, the class was pretty evenly split between those who thought it might be amusing and those who audibly groaned with disgust, and I guess you're about to find out why. And who am I? Well, I'm Ryan, but that's not important right now. I say this because, for all intents and purposes, I am everyone that you see here before you today. I am a nursing school graduate in that awkward limbo between graduation and the NCLEX. And I know that despite all of our differences about where we came from, how we were raised, our hopes and dreams in life, we shared a common experience that only we and only those who have walked this path understand. To demonstrate this, I'd like to do a little experiment. It's going to require some participation, so we're not done yet. I'm going to use a technique we were taught during school called a concept map. Remember those? Come on. Basically, it names a problem that needs to be addressed for a patient, the rationale, and some other stuff. Sorry. But we're going to focus on those first two. So students, I will give you a problem and a related to, and I would like you to raise your hands if this is something you've experienced while in the program. Okay, here we go. Raise your hand if you've had impaired skin integrity related to sitting on your ass studying for so many hours at a time that you're not sure how your pants got wet. Is it sweat? Is it pee? Is it diarrhea? I don't know. Neither do you? Nobody? I knew it. Self-care deficit related to replacing all forms of self-care with studying, despite the fact that you had an entire project during your first semester based on performing self-care. I'm sorry again, Sue. Sue tried her best with us. We let her down. Impaired gas exchange related to your decision to start smoking because if you don't pass the next exam, might as well smoke them if you got them. I get it, your families are here, you don't want to admit it. Ineffective coping related to weeping on the bathroom floor after you got a failing grade of 79% on an exam that you really studied your ass off for. You felt like you deserved more. You didn't get it. Diarrhea related to, well, just having a lot of diarrhea all the time. I don't know. That's just me? I knew it. Insomnia related to having an exam on Monday, but you work the weekend, and your concept care map is due Friday, but you have the discussion board, which is already late, and your roommate came home drunk, and the dog got sprayed by a skunk and threw up on the floor in front of your door, and you slipped in, it fell, and hit your head. Now you're in the ER trying to study on the laptop, which you made the paramedic grab before he took you away on the stretcher, but you can barely read and you don't know if it's the concussion or the fact that you haven't slept for more than 2 hours per night in the past 2 weeks. I knew it. Risk for loneliness related to turning down any invite to anything fun because those concepts aren't going to study themselves. I need some water. Nausea related to taking an exam or finishing an exam or studying for an exam or just knowing that exams are real, exams exist. Or waiting for teachers to review an exam to hopefully bump your grade up to just a sliver above 80%. Impaired financial stability related to tuition, reduced income, and buying things for school we literally used once and then forgot about, like gait belts, blood pressure cuffs, textbooks. That's me. I could go on and on, but I gotta let these other speakers say much nicer things than me. But as you can see, despite how different we all look, we have been very much the same this past year. We've done something that we all deserve to be proud of. We survived nursing school. And as we go on forward into our careers, we'll always share that bond. We've made friends, study groups, we've consoled each other and watched each other grow from naive, empty-headed first semester students into irritable, jaded, exhausted, but surprisingly knowledgeable and competent graduates. We failed exams, even whole semesters. We've sacrificed things that make us happy, and at one point or another, probably wondered if we had made the right decision, if it was really worth it. But we all picked ourselves up and came back swinging. Today, I encourage you to look back on all of it. Remember how you got here and be thankful for that struggle, because that struggle has made you what you are. You earned this day. We earned this day. And nobody can take that away from us. Not the NCLEX lady, not your employers, not your mean future coworkers, not the aggressive patient who throws his piss jug at you. Nobody. It's going to be tough out there, but if we didn't have it in us to overcome anything that the future throws at us, we wouldn't be here today. It has been one of the great honors of my life to share this with you, share this chapter with you. And if the day comes when I need an indwelling catheter shoved up my urethra and into my bladder, I hope it's one of you who puts it in. Now, GRCC Nursing, ADN class of 22, give yourselves a round of applause. We did it!
Well, let's give it up for Ryan. Up next, we have our faculty speaker, Sue Coons. Nursing was the second career for her. She received her nursing diploma from Henry Ford Hospital School of Nursing in Detroit. She went on to complete her bachelor's and master's through the University of Detroit Mercy. Sue has practiced nursing in behavioral neurology, mental health, oncology, and end-of-life hospice and palliative care. She has been a full-time GRCC faculty member since 2015 with a curriculum focus on nursing fundamentals, psych, and leadership courses. We are so pleased to have her speak with us today. Let's give a round of applause for Sue Coons.
Can you hear me all right? It's hard for us to hear back from sitting behind you, so thank you, Carrie, very much. And Ryan, I knew from day one, where are you, that you were going to be a very hard act to follow, so, and you are, so. So I want to thank you for the opportunity to share some thoughts with you this afternoon, sorry. I'm honored and I find it very fortunate to have met most of you somewhere along your nursing school journey. So I want you to just know that many years ago I was part of a meeting, a group of sorts, and I might have shared this with some of you. And previously, I had just found out prior to going to that meeting that I had been accepted into nursing school. That was a real accomplishment for me because it had been a lifelong dream, and considering that I was plus 40 at the time and my children were all growing and in college themselves, it was a real high point. And I had made the cut of 100 students into Henry Ford's School of Nursing, and the group members were kind of congratulating me, and I was definitely on a real high. You might remember that similar feeling when you got that call or that notice that you were finally off the waiting list and you were now going to be officially into nursing school. I was very excited. Well, then the peer group leader kind of burst my bubble. He was also a counselor, and he mentioned that he didn't think it was a very good role for me to transition into. He thought I was leaving a great job, but he said, oh, you know, you're going into that perfect role, that nursing role where you're going to take care of everybody and everything, and so self-sacrificing. And he was a counselor. Needing to be needed and probably enabling people as well, including yourself. I think he must have had some sort of bad experience with some sort of nurse along the way because, needless to say, I didn't continue with that group, so I never found out. But I will tell you that I started on one of the best journeys of my life, one that has enabled very many experiences. I've met some awesome, awesome people, clients and patients and students and instructors, and I've cared for incredible individuals. All of whom have taught me more about myself and life than I could have ever learned from a text or a teacher. You may have met some of those same kinds of people along your nursing school journey, and you may have had some of those same kinds of experiences as well, but I guarantee you, as you go forward, you're going to meet many more that are going to mold you and challenge you as you begin your professional nursing career. They will change you forever. Many of you know my feelings about reflections. I love to share feelings. I love to see what you write. I love your personal journals. And that's not why we're here today. I'm not going to make you do any of that. But I will ask you to reflect a little on where you've been, what brought you to where you are here today, and to consider what's ahead. At the same time, I really want you to consider all that you've accomplished, because I don't think you really give yourself credit. from those very minute details that have brought you to this moment, to those incredible, what I call aha moments, where you learned something that finally started to click. There have been a lot of sacrifices. Ryan talked about them. We recognize that. You spent, and I remember them, it wasn't that many years ago that I was in nursing school, hours spent in self-denial, self-sacrifice, studying and more studying and more studying. You missed family times together. You missed events, and you missed your friends. You missed opportunities, celebrations, and a lot of milestones. But that's in the past, and you've made it, and I want you to focus on a little bit going ahead. Nelson Mandela, who I think was an incredible man, said, it always seems impossible until it's done. And in many respects, it is done, but in many respects, it's just beginning. So what's ahead is exciting, and I've often heard students say it's a little scary to think about actually leaving some of the protective custody of the fourth floor Cook building. Just remember that you're going on to bigger and better, and it's now about the journey that's ahead of you. But before we get there, before I give you some of my advice, I guess, or encouragement, I want to reflect just a little. To all those tasks that you've accomplished and checked off, maybe you've intentionally forgotten some of them. I want you to think back to your first days on campus. Just even learning to navigate the campus and where you had to be, and then they would change the course class at the last minute. You had 20 pounds of books, and you thought you bought a book bag that was big enough to carry them all, and then you found out it wasn't. You learned to park legally without having to pay. You learned how to find those study rooms. You learned how to figure out a Blackboard assignment without having to ask your instructor, or maybe you made the mistake of asking your instructor and then you realized that was kind of a messy thing to do. You learned how to navigate Zoom, many of you did, and coordinate your clothing from the waist up. You learned how to breathe through your mask. This is one of my most favorite experiences, but when we were all required to wear masks all the time, in some places they were still wearing the shields. And those fogged up your glasses, and they caused them to drop down your nose because you were perspiring so much. And all of this was while you were giving your first IM injection, hopefully in the right spot, to a very unsuspecting patient. And then there was the student that realized that there was a little bit more sweating because the student had never seen one of those retractable safety needles. And when they injected into the arm and they didn't see the needle, they thought that needle was traveling all the way to the person's heart. And I remember that look of horror on their face. You joked, Ryan, about the concept care maps. I think there was better than 500 of them that you probably had to do, and you'll never have to post those to Blackboard again. Yeah. More importantly, you'll never have to submit something and then have it scrutinized by the professor. And why could those professors not all grade the same? Like, why did we all have to give you additional advice or contradict what the other instructor had already said? I mean, honestly. I think you need to realize you know more acronyms than anybody on social media, right? All the way from around the clock, ATC, all the way to within normal limits, WNL. There's hundreds of acronyms, and you know them all. And what about all those acquired skills and those tasks that you know how to do in your sleep now? Foley and IV insertions and injections and all those med calculations. How many struggled with PEDS calculations? Yeah, me too. Remember, I think I shared with some of you that I failed pharm when I was in nursing school. What I didn't share with you is that when I started my new job, I also failed the pharm class. So I know what that's like. Simulations and debriefings and early morning and late evening clinicals. And challenging yourself to pick tough patients. Patients that were emotionally and physically challenging and draining. Tough stuff. And critically thinking through all those complex situations, even on exams. Was it A? Was it B? Was it select all that apply? And then to be told, well, yeah, that was the correct answer, but it wasn't the most correct answer. So what was that all about? I can tell you that you are totally prepared for the NCLEX exam, and I mean totally prepared. And how to therapeutically, I can't even say the word, I should, therapeutically be able to communicate with patients without using the why word. Well, why? Why did you have to do that? Constructive criticism from instructors who obviously didn't seem to understand what constructive meant and used kind in the same sentence in writing yet, and then they put it on your anecdotal. What was that all about? It was all about personal and professional growth. And then family members or kids that decided they were going to throw up at 0500. Or parents or grandparents or babysitters that were exposed to or got COVID. Oh, wait a minute, you got COVID, right? Maybe not once, maybe twice. Those were hard times. But COVID and the pandemic really taught us a lot about ourselves. It taught you a lot about yourself as well. And I'm not sure you totally understand that. You've come through some incredible times. It made you a lot stronger, maybe unknowingly, but there were times when you might not have felt strong or successful, but you hung in there. Some days were better than others, and on those bad days, you had those special classmates and friends and family members. They were there for you, the same people that are here today. They stepped in, they stepped up, and they helped you get through it. You will remember and cherish those friendships, your classmates, the ones that you've met here, and the memories that you've made, good and bad, of nursing school. How many of you remember the 3 Ps or the 4 Ps of nursing? Do you remember them? Purposeful rounding, they called it. We didn't have that when I went to nursing school. Potty, right? When you went into a patient's room, you wanted to ensure that you did potty, pain, positioning, and that they had their personal belongings around them. Because you know if they didn't, the minute you walked out of that room, they were going to hit the call light again, and you were going to be back in. So I have some special P words as well that I want you to think about as it took you through the pandemic. Perseverance, because you hung in there when it wasn't easy to do that. Persistence, and mostly during adversity. But I have a few that I want you to take forward into your new career. Be proud of what you have done and of who you've become. It's probably a new you, and you don't even recognize yourself yet. Have patience with yourself. You are embarking on a very ever-changing healthcare environment. You have great potential for discovery of self, for discovery of others, and for discovery of your environment. Push yourself to try new things, even when it's scary. Push yourself to continue your education. That's important, and I think you're going to discover how much you will miss a learning environment. Hard to believe. Practice. Most importantly, practice balance and self-care. Of course, I'm promoting the practice of self-care. We all know that we're humans, and now you've attached that nursing title to the end of that. And together, humans and RNs are horrendously horrible at self-care. So practice makes perfect. I'm challenging you to persevere, to continue to persevere, and match it up with a little positivity. When your day is long and you feel a little beaten, focus on just 3 good things, and then practice self-care one more time. Be passionate about what you do. I think I remember Jen writing in her last post to you that be passionate about nursing, because we know that passion breeds passion. Be that professional that precedes your RN title. Be that professional in all you do. I've heard you talk about nurses, write about nurses, criticize nurses. We all do it. We do it because they were never professional. So be that professional and recognize that in yourself. If you are a prayerful person, I want you to pray for what you need and when you need it. For yourself, for your day, for your colleagues, for your patient, but most importantly, pray for whatever is on your heart. And finally, presence yourself in the lives of others. Presence yourself as that compassionate nurse who delivers comfort and care without a prescription. So much for the P's. The best way to find yourself is to lose yourself in the service of others. Mahatma Gandhi said that. So go find yourself, and as you do, think about this, because it's been my mantra since I was in nursing school. Inwardly, know that nursing is a passion that will always grab at your heart. It's a profession that allows you to encourage, to nurture, to support, to teach, to advocate, and to care and provide for and be present with. It permits you to utilize both old skills and new skills as you approach each new situation. It's a profession that lets you apply critical thinking and judgment to concepts and principles on a daily basis. It permits you, within the scope of your nursing practice, to perform autonomously and to make decisions based on an individual's needs. It's a profession where you will always be valued and appreciated. It allows you to be present at birth and at death and across the continuum of life. It's a profession that demands competence and compassion and a respect for the dignity and diversity of each person you care for and come in contact with. It's an opportunity to provide and combine both the art and science of nursing when there are days when you feel like you will not excel at either one. It leaves you exhausted at the end of the day, yet feeling like you've contributed in some way to enhance or give meaning to another person's life. And it's a profession where peers will encourage you to strive for expertise and not compromise principles or values while promoting a vision for the future. So to that naysayer of mine some years ago, whose attitude I dare say you will come into contact with or encounter during your nursing career, there will be days when you will enable, when you will be self-sacrificing, when you will need to be needed, and it will seem that you've taken care of everyone and everything. So who cares? Just remember there is someone out there that will care and will remember you, maybe not your name, like Ann Jemilo said, but maybe for being their nurse. Adelaide Stevenson was a politician many, many years before many of us were alive, but if you love history, you know a little bit about him. He said, "When you leave here today, remember why you came." Thank you for the honor of joining you in your celebration and your pinning ceremony this afternoon. As a representative of the GRCC nursing faculty, the staff, and the GRCC community, congratulations, best wishes, my very personal prayers and peace for each of you as you embark on your nursing career. Thanks.
All right, and that leads us to the actual pinning part. We have Sue and Donna Eckelstaffer, who is going to introduce each and every one of us. Donna has been an RN for 45 years. Her first year in nursing school was right here at GRCC. She received her diploma from Butterworth Hospital School of Nursing. Donna completed her BSN and MSN through Graceland University in Missouri. She practiced nursing as an ortho nurse for 12 years and later found her passion in psychiatric nursing and has been there for the last 31 years and paving the way for future nurses in the field. She has taught at GRCC since 2015, along with other schools. Donna loves seeing students grow in knowledge, competence, and confidence. So I just ask that each of the students will assembly onto stage, and the people that are accompanying them come join them as they stand up, and we will get pinned. So please help me in welcoming Sue and Donna.
So are they coming?
Where's your person? So I think we're looking for Colin. I think what we want, and what Gary explained, is we want some of you who are getting ready to be pinned to come up to join your family member or friend. So we'll call you up. Doesn't mean you all have to come up, but we at least need to get started. And we're hoping that the pinning cards that we were given, that nothing has changed, or if it's changed, you can let us know. So what will happen is, and Victoria gets to start with Colin, they'll come up and they'll stand here, and we'll read what Victoria has said on her pinning card. And if there's anybody that's taking pictures, you can take pictures with them behind the balloons, in front of the balloons, not behind the balloons. Sorry, Jason. Victoria Anderson. Just wait for her to get up again. Okay. Go ahead.
Victoria is being pinned by her fiancé, Colin. She would like to thank her family for the never-ending support and vote of confidence he provided. He never doubted her capabilities and cheered her on every step of the way. She's also grateful for her family and who watched over Willow, their fur baby, when scheduling was at its worst. Victoria wanted to give a special shout out to Perry, Bee, Tanner, and Willow. They provided support in the hardest of times, and an offer to get away when she couldn't allow herself to stop studying. She would not be here without you all. She would also like to thank the faculty of GRCC for their continued passion for educating the next generation of nurses. After graduation, Victoria is planning on doing nothing but taking in the accomplishments and spending time relaxing. For work, Victoria plans to look into the PACU positions as well as trying different units of local hospitals to determine where she would like to shift her career focus.
Shay Archibald. Shay is being pinned by her fiancé, Dr. Tim Hartman. First and foremost, Shay would like to thank her dog Finley and her fiancé Tim for their endless love and support. Tim, you've been her rock in many ways, and she can't thank you enough for all you've sacrificed for her to succeed. She'd also like to thank her friends and family for their constant encouragement. Shay says she couldn't have done it without all of you. You are all the best. After graduation, Shay plans to study for the NCLEX and have some fun. For work, Shay plans to start at Butterworth Hospital on a cardiopulmonary ICU unit. Evan Bronson. Evan is being pinned by Jason Dykehouse and Caitlin Vess. Yay. We have a threesome here. Well, not in that way. I would see these three studying all the time, no matter what time I would come into class, day or night. So Evan would like to thank their parents, Tammy and Dennis Bronson, for their never-ending support. Evan's parents have been his number one support throughout both triumphs and hardships, as well as multiple college degrees. He would furthermore like to thank his friends who have put up with the frustration and lack of availability that plagues so many of the dedicated nursing students that are being pinned today. Finally, he would like to thank his cohort members. Without those study groups, who tirelessly found time to meet and review for hours, those reminder texts making sure he didn't forget to do the assignment for tomorrow, late night panicked conversations about whether the hundreds of hours spent studying was enough, the camaraderie as they all paced the hallways after an exam, waiting for the grades to get posted, and the celebrations that followed. Without these people, it feels this accomplishment would be an impossible task. After graduation, Evan plans to jump headfirst back into nephrology, a team he has teched with throughout nursing school, and they are eagerly awaiting to celebrate his return to the team. Post passing the NCLEX, Evan hopes to one day join the labor and delivery team at one of the local hospitals, a department where Evan completed his leadership with and has found to be a very rewarding field. He says, "Thank you, class of 22. Now let's go change the world." Cody Brown. Cody is being pinned by his beautiful wife, Marissa, who has been his biggest supporter for the past 15 months. He would also like to thank his friends, family, and coworkers for their unrelenting support. Cody will be starting as an ICU nurse this fall, and he'd like to leave you with this quote from Forrest Gump. I'm going to try this. "I'm pretty tired. I think I'll go home now." Vivian Bryce.
Viv is being pinned by her mother, Lorraine. She would like to thank her entire family for coming to celebrate with her today, as well as encouraging and supporting her in this journey through nursing school. She's also grateful for her fiancé, Matthew, who has been a steady rock and constant supporter through this roller coaster. Viv stands proud as she carries on a nursing legacy that her grandmother started when she graduated from GRCC Nursing School back in 1957. After graduation, she wants to catch up with friendships and time with family and plans to take her NCLEX as soon as possible. For work, Viv hopes to join the new graduate float pool at Helen DeVos Children's Hospital and find a permanent position there, working with children in a psychiatric-based setting.
Gertrude Ann Koger. Gertrude is being pinned by her daughter, Aaliyah. She would like to thank her parents for believing in her and their constant love and support throughout her life, her husband for loving her and holding her together through the tough times, and her children for giving her the motivation to see it through. After graduation, Gert would like to devote her life to philanthropy and helping the people of her community. Allison Combe.
Allison is being pinned by her parents, Greg and Nell. She would like to thank her parents for all their support and encouragement throughout her journey to pursue her passion. She would also like to thank her fiance, Clayton, for his patience and willingness to listen to hours of lectures and understanding when she needs to study instead of spending time together. Allison would also like to recognize her grandpa, Harvey Cowham, who was her inspiration for becoming a nurse. She knows that he is watching her today from heaven. After graduation, Allison will go on a vacation to Lake Cumberland with her family and then plans to study for the NCLEX. For work, Allison will be joining the new grad float pool in the emergency department for Spectrum Health. She cannot wait to start her new career and provide quality care for those in need. Go Raiders!
Ryan DeMilner. Ryan is being pinned by his parents, Dennis and Adrian. And who else do I have, Ryan?
Evan.
Oh,
He snuck in.
he snuck in. Hi, Evan. Good name. Okay. He would like to thank his parents for their love, encouragement, and support, and for always insisting that he's smart and capable, despite some really bad parent-teacher conferences early on. His brothers Adam and Evan, sister Sarah, and his friends for their influence and understanding his needs to be a hermit for a couple of years to finish his nursing degree. Last but not least, Varv, for helping keep him sane with laughs and good soup. He loves all of you dearly and wouldn't be the man he is without you. Ryan has accepted a position in the emergency department where he has worked for the past 2 years, and he hopes to never see any of you there, unless you're working with him. He'd also like to give a special shout out to the GRCC faculty who have made a huge impact on him, and all the support to all the support and administrative staff working behind the scenes to make this happen. Congratulations. Jason Dykhouse.
Jason is being pinned by his wife Lindsay, son Abbott, and daughter Eden. He would like to thank his family for being there for him. While going through school, they provided support and encouragement through the program. Without them, he would not have made it. Also, a big thank you to his study group of Caitlin and Evan for putting up with his test anxiety and for all the hours of studying. After graduation, he's going to take a much-needed mini vacation before taking the NCLEX and job hunting.
And I think Jason's family should be thanked as well for all these balloons and blowing up these balloons. Thanks, guys. Emma, you're good. Emma is being pinned by her friends Keisha Santa Maria, Devin Lousy, and Allison Westra. She would like to thank these wonderful girls for supporting her throughout this program. They gave endless encouragement and support as she finished the program, and she is beyond grateful to be on stage with them today. They set an example of what it means to be a wonderful nurse. Emma is also grateful to her family and friends as they have supported her dream of becoming a nurse from a young age. After graduation, Emma plans to find time to relax, study for the NCLEX, and take a break from school before returning to earn her bachelor's. For work, Emma plans to continue working at Spectrum Health Butterworth Hospital. Although she is undecided of the unit, Emma would love to work in the emergency department or cardiac ICU, as she has a passion for delivering the highest quality of patient-centered care. Aaron Flynn.
Aaron is being pinned by his mother, Karen Flynn. He would like to thank his family and friends for their love and support. Aaron will move into work at Spectrum as a new nurse. He plans on studying for his NCLEX and enjoying the fall season, maybe even taking a vacation next year.
You have to know that that was one of the shortest pinning cards that we received. And we know that Aaron is a little long-winded, so nice job, Aaron. Leticia Gorey. Leticia is being pinned by her son, Albert, who witnessed firsthand his mother's endurance to achieve her goals and always encouraged her to keep pushing and reminding her each time of why she started in the first place. And to her mother, Felisa, who took care of every possible need her family faced, from childcare, home-cooked meals, laundry, children's homework, baths, gas money, and providing winter attire. Her support for Leticia during this time has been unparalleled. She would also like to thank her two young children for praying for her before every test and celebrating her accomplished goals with a special dance after each achievement. Are we going to see that dance? Yeah, they're down there. Oh, okay.
You want to dance, Anthony?
She would also like to acknowledge Laisha Starks and Latifa Van for being the most amazing aunts and continuously stepping up for her children during this crucial time of growth, and especially grateful for Latifa, who always swept away any inkling of self-doubt she was facing during new challenges. She is grateful to the many staff at GRCC who delivered a very well-planned and intentional education of the nursing process in a fun way. After graduation, Leticia will transition into a graduate nurse program with Spectrum Health on their cardiovascular care unit at Butterworth, and she plans to use the remainder of her time to study for the NCLEX in September. She will begin her studies for her bachelor's in science degree at Eastern Michigan University School of Nursing mid-October. For work, Leticia is hoping to use her newfound skills in education to help those in need, and has recently begun taking steps to volunteer at the Women's and Children's Shelter to provide a new perspective for those people displaced from their homes because of domestic violence. She hopes to learn more about ICU and continue to learn more as her career progresses. Sarah Jane Haleski.
Sarah is being pinned by her son, Zachary. She would like to thank her friends and family for all their endless support during nursing school. She would also like to thank her late father, Joseph, for all the years of wisdom and encouragement. Without him, none of this would have been possible. After graduation, she plans to take some well-deserved time off and spend time with family before advancing her career as a nurse at St. Mary's in the ICU, where she has worked for the past 9 years. She plans to start her BSN online in the next few months. She is endlessly thankful for the knowledge she has gained at her time at GRCC and is excited for this next chapter of her life. You can achieve anything if you are determined and put your mind to it.
Nicole Kermath. Nicole is being pinned by her boyfriend, Zach. She would like to thank Zach for the unconditional love and support, for the sacrifices he made in order for her to study or go to school. She is also beyond grateful for her family who loved her endlessly when she needed to pour out emotions. Nicole is also appreciative of her classmates and friendships that she developed throughout the program, individuals who understood what everyone was going through. Nicole would also like to thank her friends for always seeing her as who she was despite being swept aside for her studies. She would not have gotten through this without each and everyone's support. Lastly, she would like to thank the faculty at GRCC. You have prepared us to become RNs and given us opportunities we will forever be thankful for. After graduation, Nicole is planning to study for her NCLEX and is eager to begin her career at Spectrum's Health's Emergency Department. She says, thank you all again. Shanna Nicole Klinger.
Shanna is being pinned by her mom, Tammy, and her 4 boys, Tyson, Mason, Bronson, and Hudson. She would first like to thank her children for patiently waiting for mom to finish her degree so they could do more fun things. She is very grateful for her mom and stepdad, Paul, for countless days of taking care of the kids while she studied for endless hours and for being her biggest supporters. She would like to thank her family and friends that mean the most to her, who are here today, who are present with her today. Last but not least, a big thank you to her nursing school friends who have listened to massive amounts of venting, smiles, and laughs, and cannot forget to mention the shots of alcohol beverages after these exams. You guys have been a huge blessing throughout this program. Can you believe it? We finally made it. Shanna knows that her biggest fan is in heaven. Her grandmother is so proudly smiling down at her. This one's for you, Grandma. After graduation, Shanna plans to take a week from studying and enjoy a much-needed time with her family. For work, Shanna plans to continue working at Spectrum Health, but unsure of where she wants to be. Thank you for the GRCC nursing program faculty who have pushed and encouraged us all to fulfill our dreams.
Aiden Sean Lane. Aiden is being pinned by his mother, Lisa Lane. Aiden would like to thank his family, friends, and classmates for the constant support and motivation throughout the duration of this program. He would like to thank Kelly for being such a great classmate, friend, and study buddy throughout the tough times. Finally, he would like to thank his Nana up in heaven for inspiring him to become a nurse just like she was. After graduation, Aiden is planning on studying for the NCLEX, spending as much time as possible with friends and family, and enjoying this last bit of summer. Doesn't sound like summer out there, Aiden, but because he's missed the last 2 with school. Starting next month, Aiden plans to begin working on the cardiothoracic intensive care unit here in Grand Rapids, where he is excited to begin his nursing career and apply all that he has learned here at GRCC. Nick Macaluso.
Nick is being pinned by his wife, Alexis, and 3 children, Sam, Jack, and Gemma. He would like to thank his wife, Alexis, for all the support she's provided throughout his schooling. Alexis has been the mainstay of the family, providing him with countless hours to learn and grow as a student and person. His mom, Deb, for all her love and support and care for the kids. Deb may be retired, but she's always a teacher who nurtures and cultivates a love to learn. His grandmother, Ava, who has provided numerous meals, an environment that is warm, caring, and kept the family close. His children, Sam, Jack, and Jem, for all their hugs, drawings, and words of encouragement. They are loved more than they'll ever know. His mother-in-law, Donna, who held the fort down when Alexis and Nick were away. She has a heart of gold and generosity that will always be appreciated. His father-in-law Grant, for his kindness, generosity, and ability to connect with all. The outdoors. Then he's shown the emotional health and social benefits of nature environment. After graduation, Nick plans to work as a tech at Pine Rest and study for the NCLEX. Nick plans to become a psychiatric nurse in one of the adult units at Pine Rest.
Alexandria Marsman. Allie is being pinned by her fiancé, Bradley Irwin. She would like to thank her fiancé for being there by her side and picking up all the slack when she was too tired or too busy studying to do so. Anything during this past year. She would also like to thank her parents for always believing in her. After graduation, she plans to go on a camping trip out west to hike the national parks for 2 weeks with her sisters. Following this, she will spend her days getting ready for her wedding, October 1st, and for studying for the NCLEX. For work, Allie has been hired into the emergency department at Blodgett Hospital, where she plans to improve her skills and eventually transfer to Butterworth to work in trauma, where she will stay until she goes back to school to get her FNP, or Family Nurse Practitioner license. Congratulations, Allie. Kelly Colleen Milanowski.
Kelly is being pinned by her niece, Francie, who supported her through many ups and downs this past year, and while keeping the dog alive and the house from burning down. She is forever grateful. Kelly would like to thank her classmates and faculty for putting up with her odd sense of humor and quirks. The anxiety of going back to school really got to Kelly as she Facebook stalked her clinical group the night before class started. Luckily, she met Aiden and Vivian that first day and couldn't be more appreciative of their friendship and encouragement. Not so thankful for the parking tickets, Aiden. Kelly would like to thank her family for always believing she could do and never allowing her to give up, even in the hardest of days. She would also like to recognize the strong, intelligent, compassionate nurses in her life that have inspired her to reach for the Ativan, she means stars, when it comes to furthering her nursing career. Kelly's dad and Grandma Colleen would be proud. Now that she's graduated, Kelly plans to finish her week of work as an LPN before taking a much-needed and well-deserved vacation with family. She has no plans of studying ocean science, as if the littles would allow it anyways. Promptly upon return from vacation, Kelly will start her new position with University of Michigan Health West in their progressive care unit with hopes of travel nursing in the future.
Emily Morales. Emily is being pinned by her mother, Ruth, and her son, Ezra. She would like to thank God for teaching her to be resilient and to persevere. She would also like to thank her amazing husband, Nate, for always being with her through all the tears, surgeries, and final exams. To her parents, Kent and Ruth, for being for their constant words of encouragement, prayer, and for helping with Ezra. Kylie for being there when complaining was needed or just to celebrate the small accomplishments. Lastly, to all of her friends and family who have been there for support and prayers, Emily wouldn't be where she is now without them. After graduation, she plans to, number one, conquer the NCLEX, do all the appropriate self-care, and go camping. Emily will begin working at the University of Michigan Health West as an operating room nurse in September. Carrie Nevius.
Carrie is being pinned by her sons Jacob and Grayson. She would like to thank her husband Justin for all the sacrifices he has made to help her dreams come true, for always keeping the house a home, for keeping the kids healthy and happy, and for often waiting on her hand and foot. She knows if it wasn't for him doing everything he has done, she would not be here today. Carrie is thankful for her sons who sacrificed their own time and wants to see her succeed. Carrie would like to thank her parents, Nancy and Dan, and her mother-in-law, Kathy, for supporting her during her education. She would also like to thank her dad, Tom, who lost his battle to cancer, for helping her realize that nursing is her calling and her passion. Finally, Carrie would like to recognize the GRCC faculty who helped push her and guide her to be the nurse she strives to be. After graduation, Carrie plans to make up for lost time with her son and husband. She plans on continuing to work full-time as an LPN until she takes her NCLEX. For work, Carrie will be applying to hospice services to provide care and comfort to those grieving in our community. Eventually, Carrie hopes to be a part of creating a much-needed positive change for patients and nurses on the legislative level.
Robert Peterson. Bob Peterson is being pinned by Trista Rosing and Christine Reinecke. Christine and Trista were Bob's cheerleaders, tutors, and best friends throughout nursing school. They encouraged him, cheered him up when he needed it, cooked when he wouldn't, most of the time, called and spent time with him, so he always knew he was not alone in this endeavor. They did practice questions with him, helped him with flashcards, and otherwise gave selflessly their time and effort. They were here at the beginning of this journey, and they would not miss being here at the end. Okay. Bob would also like to thank the faculty and staff of GRCC. They always made him feel welcome to ask questions. They were encouraging, and they gave of themselves selflessly. More than once, there were some one-on-one moments that made a difference to Bob. More conversations, and those conversations were not lost on him, and his gratitude cannot be expressed in words. After graduation, Bob is going to do all the things around the house that he has neglected, with the help of his friends. Paint, yard work, working on his Corvette. He's going to spend time with friends and reestablish connections. Then he'll look for a job, if he feels like it. Jessica Poirier.
Jessica is being pinned by her mother, Jeannie. She would love to thank her mother for all of the pep talks when she needed them the most, her wonderful partner, Gavin, and her grandfather, Richard, for the constant show of love and support. She appreciates all of her family and friends for always cheering loudly in the background. After graduation and the NCLEX, she plans on taking time to relax and visit Las Vegas. Jess has also accepted a position in the operating room at St. Mary's Hospital beginning in October.
Julia Romo. Okay, over here. It's a new nurse. Julia is being pinned by her husband, Israel. She would like to thank her sons, Frankie and Vincent, for the motivation and inspiration to pursue her degree in nursing. She wants to show her boys they too can achieve their dreams, and she will be there to support them every step of the way. She would like to thank her husband, Israel, for his endless amount of patience, love, and encouragement. She would also like to thank him for keeping their household together while she was studying, attending classes, and working full-time. Julia is grateful to her mother, Julie, for her being a role model and passing on the knowledge from her 40-plus years of experience as a nurse. We're sorry she couldn't be up here with you. Finally, she would like to thank all of her other family and friends for their support and words of encouragement along her journey. After graduation, Julia is planning to spend some well-deserved time with her family and begin prepping for boards. After passing her NCLEX, she will continue to work at her current place of employment while starting her plans to advance her degree at Oakland University to pursue a master's in forensic nursing. Nice. Samantha Slaughter.
Samantha is being pinned by her mother, Melanie. She would like to thank her mom for inspiring her to pursue a medical degree and always supporting and encouraging her. She wants to thank her best friend, Melanie, and her kiddos for always being there for her and providing sanity in the chaotic journey through nursing school. Sam is also thankful for the amazing classmates and friends she has met along the way, and of course, the GRCC nursing staff. After graduation, Sam is planning to travel, study for the NCLEX, and start a new job. Go Raiders!
Caitlin Vess. Caitlin is being pinned by her husband, Brett, and her daughter, Adeline. She would like to thank her husband, Brett, for the amount of scheduled changes that needed to be made to support her in nursing school, clinicals, and class. She would also like to thank she would like to also thank and support for the support she received from her family and friends, even though that meant missing lots of fun events. Caitlin is also grateful to her classmates for laughing, crying, and panic studying together with her for the past year. She is grateful for her husband's patience in allowing her to use him as a practice patient for various clinical skills. She will be accepting any graduation gifts of bottles of wine to sip on while she's preparing for the NCLEX. I'm not sure if that's a good thing, but okay. After graduation, Caitlin is planning to spend lots of time with her children and to study for the NCLEX and possibly take a vacation that she is sure that Brett is planning but hasn't quite mentioned yet. For work, Caitlin has accepted a leadership position at Mary Free Bed Rehabilitation Hospital, where they restore hope and freedom to their patients and family members. Shantia Williams.
Sean is being pinned by her fiancé, Antonio, and their daughter, Miracle. She would like to thank her family for all their support and encouragement. She also wants to thank them for every time they tested her knowledge. Nursing school automatically means you know everything nursing, right? She wants to send a special thank you to Tony for all the times he sat with her while she cried and pushed her not to give up. His constant motivation is what kept her going. After graduation, Sean plans to board the first flight to LA. Nursing school has been tough, and it's only right she celebrate on the beach with a margarita in her hand and her favorite people. Sean plans to pursue a job in labor and delivery, helping to bring beautiful babies into the world.
Amanda Wojcinski. Amanda is being pinned by her mother, Lisa. The time has finally come, she says, and she would like to thank her husband, Brian, for the sacrifices that he has made to help her achieve her goal of becoming an RN. She is grateful to both of her parents, Dan and Lisa, as well as to her in-laws, Gary and Deb, who watched Annie, for countless hours to go to class, clinical, and of course, study. A big shout out to her oldest daughter, Ava, who helped with Annie anytime she was asked and spent her summer babysitting. You are the best. Amanda could not have done it without the endless support that she received over the years from family and friends. After graduation, Amanda plans to spend some more time with her family, then plans to study for the NCLEX and possibly take a vacation. For work, Amanda plans to find a job at a local hospital and fulfill her dream as an RN. We'll wait till the group gets down. Emily will be coming up in a second, but I'd like every single one of the graduates to stand, to turn around and face your supporters, your family and friends. Let's have a really big round of applause for them.
Well, it's been a hell of an emotional afternoon. So let's bring this to an end. Officially end our nursing school journeys, we're gonna have Emily come up and lead us in our nurse's oath, the Nightingale Pledge. Students, you have each been given a sunflower, and attached is the pledge. Please join Emily in reciting your oath. Let's give a welcome to Emily.
I briefly wanted to say that we have gifted you each a sunflower. If you look around, none of the sunflowers are exactly the same. Your nursing journey will not be the same as the person sitting next to you. Like a sunflower, remember to stand tall and search for the sun, your passion in nursing, and you shall prosper. Graduates, if you'd please stand with me and grab your oath and face your family and recite this with me. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in their work and devote myself to the welfare of those committed to my care. Congratulations, class of 2022.
Yes, they want to do pictures of it.